Hello and welcome to another edition of the Ask Dr. Pickel show, where we help people find answers who have chronic health conditions, chronic health issues. And today we are going to talk about muscle and joint pain and how there may be a different factor involved here, because there's a lot of people who have muscle and joint pain, and some people who have muscle and joint pain know where it's from. They'll say, yeah, I injured this the other day and injured that the other day, and this is why it hurts. That makes sense. You know, some things just have to heal. Sometimes just things have to get better and they take a little bit of time. But when you have a pain come up in a joint or a muscle for no reason at all, hey, I woke up with it today and I didn't do anything. Maybe. I mean, sometimes, let's say this, you could have done something 2 or 3 days ago, lifted something wrong, been in an auto accident, something like that, days ago, a week ago. That pain may not start till today. So if you can recall some type of causative event, yeah, and usually those pains will go away after a while, or you may have to do some, moist heat or something to, maybe relieve the pain, some stretches and things like that, and usually it'll go away. But when you have a pain that just is like, hey, what the heck, where's this from? And it actually hurts pretty bad, and it's maybe in my back or my neck or my shoulder or my hip or my leg, and comes on almost for no reason, and just keeps persisting, and it's there for month after month after month, and it's like, hey, and maybe it's even not in the same area. Some people will say, gosh, today it was in my shoulder, next day it's in my hip, or it may stay in the same position. But when we see these types of pains and issues, we've got to look a little deeper. We've got to say, wait a second, is there something else involved here? Because many times those types of pains and aches, muscle, joint, possibly not related to just a strain or a sprain. So we're going to look at some other possibilities here. Let's dive right in with this. All right. So is there another cause? So we've got injury and trauma, which we kind of talked about, versus metabolic or chronic. And by metabolic, I mean, hey, is there something else in your body involved? Because pain and inflammation, they don't just happen on their own. There's always an underlying reason. And these reasons, inflammation is mediated, meaning there's systems involved with the process, and that's your nervous system and your immune system. So if I pinch myself here, I didn't feel the pain here. It is perceived in my brain. Although if I pinch myself long enough, it gets red, it starts to hurt a lot, maybe even get swollen. Yeah, my immune system is engaged. Now I have to have immune system, inflammatory cells come in, all kinds of processes have to occur. So yeah, these systems are involved. So the thing is what happens is if these systems are having problems from something else. So interesting thing that I'll see with patients is that a patient may come in and they'll say, hey, I'm having this upper back pain, this lower back pain, or maybe a little more towards my right shoulder blade. I'll say, hey, what's happening here? Do you have another issue? And we'll find out, hey, they had a gut issue. They had an issue with their intestinal tract or their stomach, or maybe even their gallbladder or liver. And these areas can refer pain to other areas of the body. So, I'll see that time and time again where we deal with these gut issues and back pain goes away, shoulder pain goes away. And there's a reason for that. It's not that the back and the shoulder are, totally attached, but they are attached. In fact, our nervous system goes through our entire body. So everything's kind of connected at the brain level. But the point I'm trying to get to is that the biggest part of our immune system is in our gut. And if our gut's inflamed, that can start to cause symptoms globally in the body, different areas of the body, which is not good. So we can, so the first thing you got to really think about that is with the gut, because even people who have other conditions, one example I gave was in some recent information that came out that said, hey, 90% of people with fibromyalgia have SIBO. SIBO is small intestinal bacterial overgrowth. It's a common issue we'll see with gut inflammation. The wrong bacteria is growing in your gut, and it starts to cause all kinds of digestive issues, food intolerances. You absorb. If your gut's inflamed, another factor is you eat foods, and all foods, well, the majority of foods have a certain amount of toxic materials in them too, or infective agents. And yeah, if your gut becomes leaky or inflamed, then yeah, these bad guys, these toxic, these inflammatory agents can start to get through. And it's like pouring gas on a fire. You create more inflammation, not only in the gut, but in the rest of the body. Because again, this is about 75 to 80% of our immune system in our gut. So this can start to cause inflammation globally. Also, it's important to remember gut inflammation equals brain inflammation. So if you inflame your gut enough, you inflame your brain. And if you inflame your brain, yeah, you can start to feel pain. And this is really kind of what's occurring in a lot of patients with, or people with fibromyalgia, is, even from a research standpoint, they'll say, yeah, they've got this pain. One day it's here, one day it's here, one day it's here. Well, it's not that it's actually in their leg or their shoulder or their arm or their chest or their back. It's being perceived there. The sensory area, there's an area in your brain called your sensory cortex where it has a map of your whole body in it. So again, if I touch my finger, I perceive that in the brain and I know exactly where it's at because that map lights up in that area. But what if that map in the brain in that sensory area is inflamed? What if it's skewed? What if it is sending out inappropriate signals now because of inflammation? And now it's sending out pain signals to my foot and now my hand and now my head. So, the thing is and then it all started from that gut inflammation that caused my brain inflammation. So we've got to kind of backtrack and look through, where is it coming from? Why is it occurring? And what's underneath it? Because this gut inflammation side of things can really affect. Now, there's one other factor I want to slip in here too that can cause pains that alternate or move around. And that is actually a condition we also see a lot of. It's called Lyme disease. In fact, we've got another whole video on that. But yes, Lyme can also cause alternating joint pains, even muscle pains, where it's like, hey, it's here one day, there another day. But again, even if it's in the one area all the time, like, hey, it's always my upper back, yeah, we can still look at these organic causes. Is it your stomach? Is it your small intestine? Sometimes we'll find that is, and we'll deal with it, and suddenly, hey, my upper back pain went away. I've been getting massages for years. I've been getting chiropractic adjustments for years. I've been doing physical therapy for years. We could never get it to go away. And there were all these explanations of why it was persisting. And it turns out it was my gut the whole time, which is a little frustrating if that's, been with you for a while. So again, it is looking at these other causes, these other possibilities. So if we have that, what maybe can we do about it? Let's see if we can talk about that. All right. So I would say number one, let's do something anti-inflammatory. So I would say there's some great things that can be done anti-inflammatory. Again, before you take anything, you want to talk to your doctor, make sure you can take it, make sure it doesn't interact with a medication or anything like that. But a great anti-inflammatory that affects when you do something anti-inflammatory in the body, or take something anti-inflammatory from a supplement perspective, it's usually helping the immune system to calm down. So one of the ones that I find works really well is called resveratrol. So resveratrol, great, fantastic supplement. Again, you got to find a form that absorbs really well. That's why I like usually whole foods forms. But again, you take that calms down one of the inflammatory sides of the immune system, especially as it relates to the gut. So this can create a big difference. Maybe even like turmeric, which has curcumin in it, which also has these anti-inflammatory effects. So there's these things that can be anti-inflammatory in the body that can make you really start to have some good days. And then gut support. What the heck? What's that all about? So gut support. Well, first of all, we need to make your gut happy. So number one, stop eating junk. That is just top of the list. You got to stop eating the processed foods all the time. You got to stop eating the sugars all the time. That in itself is going to create so much inflammation in the body. Look more to your whole foods. Look for your foods that are not being processed, vegetables, raw foods. The less cooked something has to be, the more nutrients it has in it. Also, the more enzymes it already has in it so it can digest properly. That's the problem with processed foods, is they've cooked out all the enzymes. So when you eat your food, and you already have gut inflammation, if you have gut inflammation, you're not releasing your own enzymes very well. You're probably not even releasing hydrochloric acid to break down food very well. So again, the food already has its own enzymes in it that when they hit the digestive tract starts the digestive processes, which is kind of amazing the way those things were created. But at the same time, that diet can play such a big part. And it may be that you have to change that diet in an extreme way and take a lot of things out. And some people at the point where sometimes they may have to fast to just say, hey, I'm not putting anything in my gut, taking all the pressure off for a bit so that fire goes out in the house. But the eating, drinking more water, maybe even digestive enzymes, maybe even also you might need to take a probiotic to help restore and replenish some of those good bacteria in the gut. Because a lot of those, if you've got chronic gut issues, maybe you don't feel chronic gut. In fact, let's take a step back from that. We need to just discuss this really quick. Just because you may say, hey, I've got this shoulder pain, this arm pain, my stomach doesn't hurt. What are you talking about, Dr. Pickel? Yeah, gut issues don't always manifest as gut symptoms. It doesn't mean you have to have diarrhea every day. It doesn't mean your stomach hurts every day. Anything like, in fact, the nerves in your gut are different than the nerves, let's say, in your skin. Otherwise, we would feel the food traveling through our digestive tract every time we ate it, and we'd feel every part of that food hitting the walls of our colon and our small intestine. So a little different there. There's many people who say, yeah, I never have any stomach issues. My stomach feels fine, but I got this upper back pain. Change the gut and the back pain, so it goes away. So again, it's not always what you may think. The body does some different things there, but the gut support, pretty darn important. If you don't start with that foundation, it may not be helpful. The other thing too, essential fatty acids. These are very important. These good fats and oils. These are also anti-inflammatory. They're so important for your nervous system. The oils in your body that process things, even oils in your skin, our hormones are all manufactured for them. And the best source for these essential fatty acids is, of course, your foods. Now, I'm also going to put a qualifier in there because a lot of people try to get their essential fatty acids from seafood. And you're going to find out seafood has a lot of mercury and heavy metals in it. You can't avoid it. It's impossible. You just can't do it. Even these companies that say, oh yeah, we've taken all that out to 0.0001256, still has mercury in it. 0.0001256 of mercury is bad. It's not good on anything in your body, and it'll make its way most likely to your brain, but also these other heavy metals that can be in there. So that's why taking fish oil, not good, because fish oil, what they have to do is take that fish, and because that fish is loaded full of heavy metals and mercury, they call it molecular distillation. So they are basically cooking this oil at a temperature to distill out all of the heavy metals and chemicals. Well, Dr. Pickel, what's wrong with that? Well, you take these oils to the temperature they're doing that at, and those oils basically go rotten. They're no good anymore. I might get some hate mail on this, but fish oil is junk. Where do the fish get their oils? This is the question that has to be asked. Where do these fish get their oils that are so good? They don't just have them. They get them from algae. So algae oil is the source you need. That's the source where you get your best essential fatty acids from, like your EPA, your DHA, all the benefits of fish oil, but you're getting it from the source. And so, and the neat part about algae is it actually processes out heavy metals and mercury and all these other things on its own. So it's a great source. So I love algae oil, and its absorption is much better than fish oil and krill oil. This wasn't supposed to be a video on fish oil though, or on algae oil. So let's move on. So definitely, but these anti-inflammatory properties of essential fatty acids, great for gut, great for joint pain, just good stuff overall. Next one here, vitamin D. So vitamin D, yeah, we hear about that a lot with the immune system. What does that do? Why does it help the immune system so much? Well, it does a lot of things for the immune system. Think of vitamin D like one of the foods for your immune system. Your immune system loves it. That's why you need plenty of it. It helps the immune system work better. But this actually helps these what are called T regulatory cells that help to balance out your immune system, to help keep that inflammatory side of your immune system from working overtime. So actually, vitamin D has so many benefits. This isn't a talk on vitamin D today, but vitamin D crucial. Now, the reason why I put this one on here, proteolytic enzymes, this is more for you if you have an injury or you had an injury in the past or a recent injury, and you're trying to get some relief, because it may not be the gut always. It may not be an organ or something like that causing you pain. You may actually have some issues with those tendons and joints and muscles. So proteolytic enzymes, think of them proteo, which is protein, lytic, break down. So this is breaking down proteins. So you can buy what are called proteolytic enzymes, and if you take them with food, they'll break down your food, your protein in your food. But we don't want that. That's not the purpose. When you take them on an empty stomach, they actually absorb into your system, and they will go to these areas of chronic inflammation and break down these proteins that are inflammatory, which is pretty neat stuff. This stuff can work just as good, if not better, in some of the research than NSAID drugs and NSAID drugs. And if you look that up, you'll find out the name brands of those, because everybody takes them for pain and inflammation. But these proteolytic enzymes can work just as good, if not better, and don't have all the negative effects. They don't destroy your stomach lining or your kidneys or your liver. So pretty neat stuff that you can do even with those. But as far as getting back to, joint pain, inflammation, all of that, joint and muscle pain, this chronic, look for other causes. And also, if it comes on, another thing that we have to look for with patients is, do you have an autoimmune condition? Is your immune system attacking your joints or your muscles? Because this can occur too. And if it is, totally there are answers that don't involve drugs or surgery. The key is finding out why the immune system is attacking these areas and get rid of those causes. Then the immune system can calm down. There's usually a cause or a reason for these things. So, all right. Well, hopefully everybody got a lot out of today and enjoyed. And shout out to Julie Williams, Sandy, and Shelly, and everybody watching. All right. Well, everybody have a wonderful day, and God bless. And I'll see you next time. Also, one more thing. If you get a chance, share this information, please, because people, I think, need this information. They need to know that there's other things out there that can help them. So, all right. Well, take care.